You think stomach cancer is something that happens in older people. You can think again. Recently, a patient, I had just 30-year-old, fit, active person who doesn't smoke, very rarely drank any alcohol, there's no family history, but just kept ignoring the symptoms, thinking acidity, gastritis, gastric irritation, and kept delaying coming to the right professional. People generalize and dismiss these symptoms that could potentially cost their life. In this video, I will explain how stomach cancer can hide it easily dismissed as acidity and gastric problems. So this video is an endoscopy, which is the camera examination of the food pipe. So we are just going through the mouth and to the back of the throat now. And in a minute, you'll see there is the what we call as the vocal cords, which is higher up. So we have to go below that in this area to get into the food pipe. So this is a simple examination. Patient is quite wide and awake, very simple test. So now we are in the food pipe. So we're just clearing the lens of the endoscope to advance the tube going down the food pipe to see what's the problem. So as we are going down the food pipe, we are just suctioning, clearing any liquid, and then it's the junction of the food pipe and where the stomach begins. We seem to see there is a problem here. So our endoscope is very thin, but we cannot go through this. That's because this whole area is very abnormal. So there is a growth. It is all ulcerated and it's very narrowed. So the endoscope is the size of my small finger, even smaller than this finger, and that itself cannot go through. So obviously there is a problem here which looks serious. So we will need to examine this closely. You can see all of this is looking ugly. If you compare to the normal part of the food pipe, this is clearly abnormal. So we're just trying to see if we can get through this area, but it is not easy. That's because it's quite a tight tumor. So there is a growth that has been formed for some time. And with my experience, I can tell that this is a cancer. So this is a cancer from the stomach that is coming into the food pipe. So this is already looking advanced. So we need to take a look at this area closely and take some samples of this area to confirm what I am suspecting. So this young man who is only 31 has now got what looks like a gastric cancer. So he's been getting discomfort after eating food, started to feel full after a small meal, repeated burning sensation, feeling nauseous. And because every time he had food, he was feeling uncomfortable. So he started to cut down on the amount of food what he was eating. Naturally, if you're not going to eat, you will end up losing a lot of weight. He's been going and seeing various doctors locally and kept on taking antacids. Nobody has actually taken a decision to refer him to a specialist gastroenterologist to see why is this person repeatedly consulting? Why is he losing weight? It can't just simply be acidity. By the time we have seen him and advised him to undergo the endoscopy procedure, as you could see that it wasn't already looking good. So you can see on the screen that he has unfortunately already developed a tumor. So this is what we call as an adenocarcinoma, which is a typical gastric tumor. So the tumor is fairly big, which we can't even get into the stomach. So this could have been picked up 4 or 5 months ago at much earlier stage if we had seen a gastroenterologist. Naturally, this has come as a major shock to the patient, his family. There are a lot of questions. How? Why did this happen to me? I am so young. How can I get stomach cancer? There is nobody in my family. I don't have any bad habits. All these questions, it's understandable, but it's not easy to face the harsh reality of a cancer in a younger person. Why young people can develop gastric cancer or stomach cancer? We often think cancer itself is an old person's disease, but no age is exempt. This is why we are talking about this. This can strike at a very young age, as young as 30-year-old, as you can see. There are a variety of reasons for this. Certain risk factors that we can all change. Smoking, alcohol regularly, even moderate use of alcohol and smoking combined can significantly increase somebody's risk of developing various cancers, especially so for gastric cancer. Our diet, lifestyle also matters, because if you're consuming a diet that is rich in non-vegetarian, red meats, especially foods that have got high amount of salt and very little vegetable and fruit, these antioxidant rich food. If you're leading a sedentary lifestyle, there's not much physical activity, this can also be putting you at risk of developing gastric cancer. In our country, there are so many people infected with this bacteria called H. pylori, Helicobacter. This causes repeated gastric irritation, chronic stomach inflammation, chronic gastritis, erosions, and this bacteria can also put somebody at higher risk of developing gastric cancer. This bacteria is so common in our country. If I get hold of 10 people on the street, I can find H. pylori in 4 out of those 10 people, but it doesn't always cause problems in everyone. For those who are getting repetitive gastric symptoms, we need to deal with this bacteria. Sometimes, unfortunately, there is nothing anyone can do about it because they have inherited a genetic risk. So they happen to be unfortunate to carry a faulty gene. If there is family history of gastric cancer, breast cancer, or other cancers, that might also put them at risk of developing stomach cancer. So family history is also very important. Lastly, one of the most important things which I find is people are missing warning signs. What are the warning signs for stomach cancer? If you are feeling full repeatedly, heavy, bloated repeatedly, small portion of the food you start to eat and you start to feel very full. If you start getting repeated burning sensation, frequent acidity, having to take medicines, and also medicines are not helping, starting to feel repeatedly nauseous, pukish sensation, also sometimes vomiting. If you start to lose weight without trying, this is a major alarm sign. If you also start to generally become weak along with nutritional deficiencies, your blood count, hemoglobin is starting to go down, that's because of a large like an ulcerated tumor can also cause internal bleeding. If you have any of these persistently along with low-grade abdominal discomfort, this could potentially indicate stomach gastric cancer. Young people often delay checkups assuming they are too young for serious disease. And also people seek advice wrongly from various quacks, these so-called gut health experts. There are so many of these online, offline nowadays. They are not qualified professionals. They don't even know what is going on inside. So how can they give the right treatment? This patient is just an example. Just because we have done an endoscopy and directly looked at the food pipe and the stomach, we have been able to pick up this gastric cancer. The good news is stomach cancer you can potentially prevent and also cure, provided if we can detect early. So here is what I tell my patients. Do not ignore persistent symptoms, which I have mentioned earlier on, especially if you're losing weight. Try and eat a good balanced diet, a diet that has got good amount of antioxidants, so wide variety of vegetables, different fruits, seasonal fruits. Cut down on the processed meats, these burgers, hot dogs, junk foods, smoked meats, pickled foods. Too many pickled food is also not good. And take more vegetarian protein. If you're a smoker, you need to quit. If you do drink alcohol, keep it to very occasional. If you have a family history or somebody there is different cancers running in the family, you need to consult a gastroenterologist and discuss whether you need to be screened. And also, if you're suffering repeatedly with the gastric symptoms, you might be thinking it's just simple chronic gastritis or it is simple acidity. It is important to check for H. pylori and also clear that. Please subscribe to this educational channel to spread more awareness so that more and more people can benefit from these digestive health series from Bangalore Gastro Center hospitals. Thank you.